Yesterday we launched the CHI2 project, the public launch of the CHI2 project. That's the Child Heat Impact Climate Health Interventions. And we were pleased to have a very broad range of participants in our meeting, which included quite senior government officials from national and provincial level, as well as local government level. We also had very good representation from our community organizations and academia. We were pleased also to see a high representation from the University of KwaZulu-Natal senior management. I think for me, the importance of having all of these stakeholders present today shows, one, the level of commitment to the project, and two, the fact that people are keen on addressing the issues that this project is addressing.
I want to share with you a set of slides which for me brings the real visual aspect of the impact of climate change on Africa in particular. And this is showing how the temperature will increase up until 2100. Your work over the next years is going to be instrumental in changing lives for Africans. And it's been 30 years that people like Professor Naidu, his predecessor, Dr. Mark Colvin, has walked along the road with us. And in South Africa, we use the word ukukapa, where we say, we walk along with you in your struggle. And you have walked along in our struggle with us and with CHI. So I would like to say, a viva to CHI, viva!
The project itself is divided across 6 work packages. The key operative work packages are work package 1, which is looking at building community of network, which is what we're talking about, the stakeholders' participation in the project. Work package 2 is going to be focused on assessing heat exposure of our children in the different places, whether they're in classrooms, in their homes, in schools, recreational areas. What is the heat that they experience? Work package 3 is focused on the health assessments, both looking at the lung health, but also measuring their core body temperature. Then we're looking at how we have social impacts of these in work package 4, which is asking questions from the community, from the parents. How are they addressing heat and how are they managing the challenges that they face? And then finally, in work package 5, we're looking at the interventions. So what are the things that we need to do? Changes at schools, changes in the homes, changes in policy, and also just generally making the communities aware of the problems that the heat is going to cause on their health.
My name is Kadir Tajiroba from Harama University, and I'm the PI for Ethiopian side, and I'm leading the Ethiopian CHI2 research project. So the goal of the today meeting is to discuss and to identify what are the sustainable, doable climate change interventions that reduce the respiratory risk of children in school.
My name is Cliff Zinyamba. I'm from Zimbabwe. I'm a lecturer at the University of Zimbabwe and a researcher there. So I'm a researcher in climate and health. That's my passion. So in the CHI2 project, I'm involved as a co-investigator, and I call it 2 work packages. So work package 1, which is about developing a theory of change, and work package 4, which is about the lived experiences, the qualitative insights. And in terms of the Zimbabwe site, we have 2 sites where we're going to conduct our research, and these 2 sites are in Harare. They're both in Harare, in the high density residential neighborhoods. So these are low income neighborhoods.
My name's Becky Lucas. I'm an Associate Professor from the University of Birmingham, and I'm really proud to be a partner and part of this project. So the expertise that we're bringing from the University of Birmingham are around environmental physiology, and specifically how people in their day-to-day lives are affected by heat stress, and how we can measure that acutely and look at some of the clinical and long-term health impacts. And this project, it's really exciting to start to explore this question in a younger population and school children, and to understand their environment here in Africa and the impacts that are already affecting that cohort from the results of climate change. So we look forward to working with our partners, and particularly the communities that we'll be co-designing some of the interventions with, to see how we can effectively take some climate action.
So my name is Ebba Malmqvist, and I'm from Lund University in Sweden. And we have been collaborating with the different research centers in Ethiopia for the last 10 years. And we've been working mainly on air pollution. And we've also seen the impact of climate change and heat exposure. So I'm very excited to join this project, focusing on children's health and the real importance of heat exposure and climate change impact in this region of the world.
This is a project about children in heat. And to me this is very intriguing, because I have been working with heat exposure in adults in the occupational settings, and for our kids, school is their occupational setting. So I want to bring my expertise from that into South Africa, Zimbabwe and Ethiopia.
At the end of this project, we hope that we will devise sustainable, continuous intervention that reduce the effect of heat stress and climate change impact on children's health, particularly on respiratory health, so that the children can live in healthy, reduced heat and productive environment that improves their education, health, and also reduce school absenteeism, so that we can have the environment that is, sustainable for next generation. That is we hope. During the project, we expect that we can have a multidisciplinary team that generate a new and innovative idea.
Conference of Parties is taking place in Belém at this very week in Brazil, where people are talking. But like one of our keynote speakers mentioned today, they've been talking for 30 years, and the world is still getting hotter. Unfortunately for us, Africa is going to bear the brunt of this. It's our responsibility to protect our health, the health of our children, but we as leaders need to recognize that political change is critical.